Okay, hello and welcome to episode 33 of Dano Says So. Today is a return guest, actually the third time I'm sitting down with her, but the second time we're airing an episode, who I have been after and bugging and pestering to come back on because of her unique knowledge and her unique expertise. I, both the first time she was on and now, I'm much more comfortable letting her explain that, so I'm just going to dish right to her. Alexia, thank you for doing this. And why don't you tell them what makes you the smart kid?
God. Okay. So yeah, I have a background in epidemiology, specifically infectious disease. I got my undergrad in international relations, graduate degree in international community health, focus on international epidemiology at NYU, and then worked for about 7 years at the Washington State Department of Health, running CDC HIV TB trials. Came back to California and worked at UCSF, California Department of Health, doing, again, various infectious disease epidemiology, hepatitis to HIV. And then now I'm in oncology at a biotech. So I kind of switched over out of infectious disease.
Okay. And the first time we talked, things were largely editorial. I picture today being more informational for very specific reasons. We are now down into the nitty gritty, into the process of getting this country, and I guess really the world, vaccinated. There's a lot of hesitation that surrounds it. And frankly, there's a lot of ignorance that surrounds it. Before I ask you about that, last time we talked, you and I talked about the potential for vaccines on a much shorter window than is ordinarily the case was possible here. Would you say that's what happened?
Oh, absolutely. Yeah. So typically, vaccines are approved at a 5 to 10 year span. But there were a number of factors as why that didn't happen this time. It wasn't because the science was cut. It wasn't, we don't have to worry about our own safety. All of the key things that we do in terms of safety and efficacy, all the way from a first in human phase 1 all the way to approval. Now we're in phase 4, so up to that phase 3, all of those safeguards were still created. What we did as a community worldwide is actually going to change the framework for doing clinical trials in the future, because we were able to cut time in places that didn't jeopardize patient safety or the science. So I think that's key. And there's just, when you work in the clinical trial space, there are just these things that we do that because that's the system and the way that you do it. But when you're faced with a pandemic like never before, where people are dying, you need to draw your fastest teams together. Everything else is not on, your normal timelines. Things are changed so that we can get the data as fast as possible. And it's not going to take years to enroll patients. I mean, unfortunately / fortunately, we have a plethora of people from which to enroll. So we're not waiting years to enroll 3,000 people, 30,000 to 40,000 people, 5 to 10 years. So that cut a huge thing. And then we cut the data. Well, I didn't, but the way that they ran the trials were they got people together at key points who were spending their whole time on this. Whereas, when you make something a priority, you can figure out ways to effectively speed things up safely and appropriately. And there was a number of factors of why we were able to do that, which has nothing to do with jeopardizing people's safety. I mean, the regulating bodies would not approve this. It still has to read out in the data and the science for it to get approved.
So one of these things I find interesting is that in this country, Johnson & Johnson as a single shot was just approved, right? And Moderna and Pfizer are both out there as 2 shots. I've had the first Pfizer shot. I go back on the 23rd for the second one. As a layperson, that actually has me scratching my heads. Would you say that one is to be trusted over the others? I mean, I grasp it well enough to know that they're all positives, and that if you have access to any of them, you should utilize it.
Yes. So the very clear message is whatever vaccine you can have access to, get it. Johnson and Johnson is not less effective. Moderna is not less effective between the three. The purpose of the vaccine is to decrease hospitalization and severity of disease, basically keep us alive.
Okay.
And keep our healthcare infrastructure functional, right? So keep people out of the hospital. So, so that's what these vaccines do. So what you want to look at by comparing, which isn't really truly what you should do, they're all effective, because if you look at of what they're supposed to be doing, which is prevent severe disease, prevent death, they're all across the board at 100% for no hospitalization and no severity. So they're all great.
So can I jump in for a clarification real quick? You and I touched on it a little bit before we started taping. So what they do more or less is prevent effect or severity of effect, but a vaccinated person can carry the virus, yes?
Yeah, absolutely.
Okay.
Yeah, so you can be vaccinated and transmit the disease. You may be asymptomatic, you may have little cold symptoms, you may not even know you're infected. That's going to take years for us to really know about transmissibility once you're vaccinated. The idea is that transmissibility is low, but we don't know. Like, we need to wait for more data. So you get the vaccine, you can still get COVID. You'll get less severe disease. It now goes from dying to maybe a little bit of a cold, maybe a cold with a slight fever. Your lungs aren't implicated. Do you know what I mean? Like, it changes. It keeps you away from death. So
and their efficacy on that level is overwhelming, correct?
Yeah. And because it would have shore out in the data. I mean, 28, almost 20 million Americans have been vaccinated. No, sorry, I think it's something like 92 now. Sorry, that's number of cases, but like 92 million Americans have been vaccinated. If there was issues with the vaccines, we definitely see it by now, because that is a huge population number. But also that I think the key thing here is, if you're vaccinated, you can still get COVID and possibly transmit it. That's where we're waiting for more data.
And that's what's scary. Like, I have a very specific situation in my family where I'm most likely going to be exposed to my father before I would like to, because of a recent emergency in his
Right.
situation, and needing to make his home habitable so that he can so that he can be released from the medical rehab that he's in right now. And the idea of me running around in his space, even maxed up, while I am vaccinated, but he is not, terrifies me. I'm trying to do everything I can to get vaccination for him prior to his return home, but that may not be the case. That's a realistic or a logical fear, isn't it?
Yeah, and the new recommendation, exactly. The new recommendations, I have the same issue. The new recommendations from CDC that came out yesterday is that you need to be wearing a mask because your dad is unvaccinated and he's in the high risk group.
Absolutely. Okay.
So I'm just, another thing I think is important here is, once you're vaccinated, it is one of the tools that we have. We still need to physically distance. We still need to wear masks, even when we're vaccinated. Particularly among people in the high risk setting inside, which is you, with your dad, but even outside, and still don't congregate in medium or large size groups. But if you're all vaccinated and you're inside a home in a smaller setting, that's okay. You don't need to wear masks if all of you are vaccinated.
By what milestones or by what road markers does that eventually not be true? I mean, at what point? I'm not asking you for something predictive. I'm asking you for the standards. But I mean, at what point do we really start to experience freedom of movement?
So we have to get a much larger proportion of the population vaccinated, and we need to see that these variants are not actually continuing to spread. So although cases have gone down in the recent weeks, some areas there's hotspots it's spiking. And in some areas it's plateauing or going back up, right? I'm thinking Rhode Island, New Jersey, Missouri in particular in the last couple of weeks. And so With the implications of these different variants, although the vaccines are still very effective among them, we assume that they're fine, and perhaps we need to get a booster or just a vaccine here and there. But at this time, for the variants we know of, it seems to be like they're from the real world data. That means in the field, not in a petri dish. It seems to be that these vaccines are safe. At this time, I know there's a lot of like fear mongering headlines, clickbait stuff, and then people just it's something to track and monitor, but it's not something to be thinking that your vaccine isn't going to work over. But the key is it's plateauing or going up in these certain hotspots. About 10% of our US population is vaccinated. We need to get to 70%. So we need to increase that as variants are increasing as well. Because we don't know what new variants are around the corner, and transmissibility for that UK variant is 50% higher. So, a bit more transmissible. And so it's like a race.
Well, variants were one of the questions I was going to have next.
Okay.
Is there the potential for new variants to knock us all the way back into the winter bucket, all the way back into sort of the horrible numbers that we saw over Christmas? Or is that, I learned the first time it's never fair to try and put you on the crystal ball. So instead, I just kind of ask you for a logical take on it.
Yeah.
Can these new variants, which I'm hearing seems like every new variant, South African, wherever, that they're all being labeled as more transmissible, more easily transmissible. Well, then does that not place us in danger of losing all of this forward progress?
Yes, temporarily, I would say. So we're making forward progress in vaccinating people. That needs to move at exponential paces. So far, I think we're doing that. But we have, spring break is coming up, and with only 10% of the population vaccinated, there's still vectors out there. We could see increases again, like winter. I mean, if you think about the curve, it hasn't plateaued lower than what was happening in July. So that's why we need to be careful, is we're not at 0 cases transmitting. It's still in the community. It's like we were in the summer, and when people were indoors, it spiked, and there's still very much an environment for that to happen.
Ironically, we're back around similar numbers to when I first interviewed you, and I was terrified then, and now we're celebrating that we're back at those levels.
Exactly.
Right.
Exactly. Yeah, it's all relative. Yeah, I mean, if you think of the pool of, and I'm sorry, I'm just thinking in terms of the US, but you could apply this globally. Other countries haven't even initiated vaccinations yet. So there's still much more opportunity for the virus to continue to spread. We are not out of the woods. We need to pedal to the metal on vaccines, vaccinations, and we need to focus it in the places where case rates are very high.
Could something like
we're not doing that. So okay. I need that loud and clear. That is a problem.
Cool. I don't mean cool that it's a problem. I mean,
no.
Cool that you enunciate. It's something like, I know if I were to ask you to editorialize it, and I know I will see a good hard punk rock patch of your frustration, but from a technical standpoint, it's something like what's going to happen in tomorrow in Texas, dangerous to the nation as a whole.
The no need for
everything
mask.
Swings wide in Texas. No mask mandate. Businesses 100% open.
It's pure insanity. It's pure insanity. The virus doesn't care. Cool. The virus doesn't care. You're essentially giving death sentences. But here's the thing, Dan, that I think people don't understand, and this is where I'm concerned, and this was my point 2 seconds ago. A virus does not know a boundary. So who cares that Texas stopped with, saying, all businesses are open, there is no virus. Well, the problem is those people travel, and now it becomes a California problem, it becomes a New York problem, it becomes a Europe problem, it becomes a Brazilian problem. That's the problem, is like one person, one group. If this is not standardized across federally, globally, we're all still in trouble. We're all still at risk.
So this singular constitutional argument, although states' rights things, we're back to arguing with Alexander Hamilton. Is a federal mandate not a legal possibility?
I don't know. I'm a lawyer. I'm not a lawyer.
Right.
I don't know, but God, I feel like
that's the impression I get.
I'm really upset about how this pandemic went down and politically, because CDC has lost so much credibility. And so when they put out guidelines, or when they're saying anything now federally, like Biden has doubled down and it's great and the scientists are leading, but unfortunately we have lost so much credibility that alone isn't enough. So guidelines aren't enough. So no, you cannot mandate the states, and that's the problem. Had we had another institution when this came out, perhaps it would be different, but I feel like science, public health in particular, has been that sort of credibility has been eroded, and 99% of people's time is not just talking about the science. It's literally trying to get people to damage control, basically fix the rhetoric.
This is a tricky subject for the two middle-aged white kids to hypothesize on, although I'm older than you, so maybe that's not fair. But I know that a lot of the pushback and a lot of the resistance to vaccination comes from communities not like our own. In other words, from groups who have historically, suffered in this sphere and who are understandably not trusting. Anything you'd like to say about that? Or anything you'd like to acknowledge about that? Because it is a sad thing, but I don't feel like I'm in a position to poke holes in it.
Yeah, and I don't think we need to poke holes in it. I completely understand it's a fair and valid response to some direct impact that science and public health in the past has done to communities of color. And I can't speak to, it's happening today, just medically and scientifically, or clinically, diagnosing disease is different for a white person than on color of a different person's color of skin, just like on the epidermis, right? So you don't have textbooks that speak to that alone. It still is a problem at a very, very basic systemic level. But all I can say is I completely understand, and I do know that there is some, I know in California at least, there is some attempt to increase vaccination in the communities, to push for equity of vaccination in the communities that are hardest hit, which are predominantly Black and Brown communities based on health disparities. What's interesting is if you scratch the surface a little bit, those communities still aren't able to administer as many vaccinations as they'd like, because I guess something, you need to have a database set up at your community clinic, and it's they don't even have the people to do that in order to then vaccinate and collect the data. So there's all these barriers even to getting it out.
Pivoting.
What bothers me, it's been 10 months. How come we haven't been prepping for this?
Well, it's been
no, a year.
It's been 2 months since since the federal government, its impact on the flow of information, was resistant to doing anything.
Right. True. Yeah. Right. Yeah. So I guess it's not really been a year in terms of it wasn't even, they didn't have an infrastructure or protocol to respond. Yeah.
I'll be the one who waves a political flag here for a minute. The big lie in 2020 to me was not election results and voter fraud. That was the big scam. The big lie was the nature of this disease, the danger of this disease, the future of this disease, and the handling of this disease. And that lie has a body count, a massive body count, not a few police in the federal government. You know.
Yeah, I totally agree with you. That had the biggest impact.
Right.
Yeah.
I have a viewer, a fellow named Scott, who you had a quick interaction with, civil interaction with in a comments section on our social networks, but he was on the fence about getting vaccinated.
Right.
Nice guy, decent guy. We share similar tastes in music. He had the virus.
Yeah.
And I think that that's probably true for a lot of people watching this.
Yeah.
Explain getting vaccinated for somebody who's had the virus.
Oh my God, I'm so glad you brought this up because I think I told him one shot. I think that was the early recommendations, but I actually just knew or the CDC recommendations are for someone who's had COVID, definitely get vaccinated. You don't, so not just one shot. I think they want you to get the full vaccination. So 2 doses for Pfizer and Moderna and 1 for Johnson.
Okay.
But yeah, the reason is the protection from vaccination is much stronger than the protection from infection. And here's why. We have
Well, I guess that's the opposite of scary.
No, that's great.
Yeah, okay.
Yeah, we want that.
And you dumbass.
No.
I don't mind. That's why you're here. Anyway, go
on. But I'm glad you brought it up. So we have good data on infection and how long someone is immune. You have protection up to 90 days, but we don't really know past that point.
Right.
For those that have been infected. For those who have the vaccine, you're protecting yourself from severe disease at 100%. And we think that transmissibility is less, but we don't know. Again, that's why we're wearing masks. But your protection from vaccination is much stronger because we don't. So if someone who's infected, you don't know how, if they were, and reinfection too. So protection from reinfection. Vaccines will protect you from that versus an infection. You could, although very low, I know that was controversial for a while, but the data are showing that reinfection is actually very low, but it is still a risk. And if you had COVID, you could still get reinfected.
Well, is there any additional downside in full ride vaccination for anybody who's previously infected?
No.
No. Okay.
No, you just need to follow the guidelines, which is like, I think you wait 90 days until you're allowed. I mean, you have to look at the guidance, but it's like you have to wait a certain time until you're symptom free.
The timeline that I'm on myself, just to put it in the first person and not to push it off on this friend I just messaged or mentioned, I've never been diagnosed with it. I've never been tested with COVID, right?
Yeah.
But my suspicion has always been that I'm an ass for not getting antibody testing because I had the worst respiratory illness of my entire life last February. And we know that it was here earlier than we expected and earlier than a layperson like me would know what it was.
Right.
You know, it was in my rearview mirror by March, but what troubles me was that I had this new sensation as if somebody had rubbed icy hot on the inside of my lungs, recurring over the next several months, right? For that reason, you know, as my education in this grows, I feel more and more certain that I've probably carried it at one point or another. So I'm pleased to hear that there is no added danger in getting, for me, going for 2 Pfizer. But what I did want to ask you is I'm reading all these horror stories on the social networks because I'm still one of these fools who lives alone and spends too much time on his cell phone, but about adverse physical reactions, particularly to second doses. What causes that? What's going on when that happens?
It's just, I think just you're getting, so good question. When you have a physical reaction like a fever or cold, you're down for the count for 36 hours because you're like sweating all night and blah, blah. This is a good thing. Okay. This is a good thing. We want our bodies to respond that way because it's telling us that we're building the immunity to this specific disease. The whole reason this disease is scary and has spread is because we humans have never seen it before. So our body had no ability to fight it. So when we vaccinate ourselves, we are essentially putting in not live virus, but a copy, like a blueprint, and saying to our immune cells and antibodies, please create something. That's what your body does. A fever is your body fighting an infection. So we're saying create the cells to fight this. And when you get a fever or cold, that's your body working to fight this new host or whatever, this new scary virus. So yeah, people are at the second dose, it seems like people are getting sick, whereas they weren't before.
Right.
And it just may be that it's like they say it's like you're at it like at your first shot, you're like, okay, you're protected. You're probably not going to die if you get it. Because again, we don't know how it interacts in everybody. It seems we have all these outliers and you don't really know how your body's going to take it if you get it. But with the second dose, it's like, bam, you're good.
Yeah, I had no reaction whatsoever to the first dose. I didn't even so much swallow at the injection site.
Oh, awesome.
I'm sort of planning on having my ass kicked on the 23rd though.
Yeah, I would. Yeah, and what they're saying is, take the day off.
I'm taking the next day off, but yeah, okay.
Yeah, take that day off. Yeah, prep to be in bed probably, but you're gonna feel crappy for 24, 36 hours. But isn't that better than being afraid you might die?
Oh yeah.
Or having long-term COVID effects. It's like,
I'm going to ask you a finger paints question, and then I wanted to get into some hypotheticals or some logic questions with you about disease and about the future. My finger paints question is this. We're doing a lot of technicalities here and a lot of what ifs and a lot of, oh, it'd make you sick the day after. Oh, the information keeps changing. You can say definitively the vaccines improve your chances of survival.
Yes.
On a dramatic level.
Yes. Yeah. So yeah.
I know this. I think sometimes it's good to spell in giant capital letters as well.
What?
I said I know this. I just think sometimes it's good to spell in giant capital letters.
Right. The whole purpose of the vaccines are to keep the hospitals free and clear, i.e. you don't get severe disease and you don't die.
And it seems like hospitalization and even death is way down, at least in Southern California. I don't know about the rest of the country.
Yeah, but spring break is coming up. Again, we don't have a large proportion of the population vaccinated, and we have variants, and variants continue. I mean, it's the disease purpose to mutate. So this is very common. And actually, COVID isn't mutating at a fast pace as others.
Okay. So you and I did a panel that we ended up not airing.
I know,
but which which I think everybody involved really enjoyed, and it was a chance to listen to some very cool people speak. But you said something that scared the hell out of me and scared the hell out of Vic Bondi when we were all on this panel.
Oh, really?
You referred to this as not. Well, he said as much during that panel. What you said, this is not a deadly pandemic.
Yeah.
At least well, awful lot of dead people to say that, but I know you meant that a specific way. Yes. Could you please expand now?
Yes. So, and I said it in our first one too. So, this is preparation for the actual, bigger, I don't want to take away from the 500,000 plus people that have died in this country alone. It is unacceptable and it is inexcusable. It didn't need to happen. That said, we were decidedly unprepared. We could have been prepared. We decided not to be.
Okay.
What I want to say is this is not a disease that once you get it, you are, it's not just old or underlying condition people in the hospital. It's a deadly virus with a much higher case fatality rate, and much quicker and much. You're talking
about potential in the future.
Yeah. Oh yeah. Not now. Yeah. Okay. No. This is actually, this is like the pre-run, the pilot to a pandemic that could essentially wipe out the human race. Like,
what leads to those what leads to those conditions? What is it that we're doing, or is it something that we're doing? The bigger and nastier bugs of death, are on the horizon. Like what conditions? What evolutionary conditions are making this?
They're not on the horizon, Dan. Oh. It's just the fact that people we have not had a pandemic in our lifetimes currently to have to go through this process. So it's fresh for everybody.
Well, there's historical precedent.
But people in the field have always prepped for this and know that, you know, those diseases are out there as long as we have animals living in close proximity with us, or lakes and streams. And, you know, the goal of disease is to evolve and stay alive. Our goal is to stay one step ahead of it.
All right.
So we've been fortunate up until prior to this pandemic that nothing has happened. I'm on a phone.
I have a guest.
I will get you the Anderson Star Pack. That's my son. Okay, can you close my door?
He added a perfect human element. Thank him afterwards. All right.
He's obsessed with this soccer. I mean, it's a goalkeeper. He's obsessed. I mean, it's my favorite goalkeeper too. But anyways, so yeah. I mean, so this, it's because it's new to people. But there's experts. There's people they spend their whole life's work doing this. I mean, I've always been the one that was like, I'm scared of bats because we seem to get all the bat diseases, but you know, there could be, I'm not scared of bats. I shouldn't say that. No, bats are super fascinating. We just seems to, their diseases seem to just jump to us. But again, I'm just saying disease is out there and its whole job is to evolve and expand. And we're perfect hosts should they get there. Our job is when that happens is to do better next time because we have completely botched this opportunity.
It almost seems like no degree of terrible outcome during this pandemic would have created the necessary awareness to prevent. I envision a deadlier, faster disease showing up and at least being met initially in this country with the same cynicism from the same people, which is a terrifying notion.
Yeah, I don't agree.
Okay.
Because this, I know this is so shocking, but because this disease didn't wipe out mass amounts of people very, very quickly, it did when we were not protecting ourselves through public health measures. But even then, it was like slow to grow, and it, you know, because you could not get it for a certain number of days, and some people just got a cold, as particularly younger people. Imagine a disease where it doesn't matter what age you are, and it hits deadly in children and infants. How do we control that spread? Like, there's just a lot of factors, and I don't agree. I think that something more deadly, like how Ebola is, would have the severity and the fear factor. I think that this got away because it didn't get in my backyard. It didn't hit my family. I'm fine. They didn't see it firsthand.
So forgive my ignorance, but you create a perfect opening for me to expose it. So Ebola was a nastier beast, yeah?
Well, Ebola, you know, you're dead within 24 hours. But the crazy thing about that is, and you can, it's still transmissible in the court. It's highly transmissible, and it's transmissible with the corpse. So like, you have to be super careful. But the thing is, why it doesn't get out of control is because
that's where I was going.
You're dead within 24 hours. So
it's hard for people not to take that seriously.
And it's harder for it to spread.
Oh, wow.
Think about it. Because if I'm asymptomatic up to 14 days, I've now spread it to 3 billion people.
Well, you can't fuck me up in the supermarket because you're dead before you ever get there.
Exactly. See, that's beautiful. That's layman terms.
All right. There is a danger in leaving things on the field, which when I would do this interviewing people for fanzines, I didn't mind saying, is there anything else? On film, it always feels a little bit clumsy. Yeah. But is there any crucial ingredient here that I haven't touched on that you want to make sure you get out?
Right. No, you actually, all the things I was thinking about, we actually talked about. I think the key message from me is that people think that, 90+ million vaccinated in the States. Wow, we're at the end. Things are opening up. My kids can play soccer. My kids are going back to school. Right. We're at the beginning of the end. we have to continue to be safe and continue to protect ourselves via the tools in our toolkit. Masks, distancing. If you're not vaccinated, masks indoors with those who are vaccinated or not vaccinated, and those that are vaccinated can only not mask with those vaccinated.
Yep, I was able to follow that. So I want to express something to you. This went up and down. There were professional concerns and different things that were expressed when you and I dealt with different situations here, and you remained open to the notion of talking to us on here and to doing these episodes. And we got another one in the can. Without these particular episodes where we're talking to you about this very specific, very important thing, the character of my little microscopic show is different. So I have immense gratitude to you for that, okay?
Love you. And I really appreciate you allowing me to, I've really enjoyed talking with you. I think if we could just help, I think I think it's super important, and I'm glad that I can help our music community. If that's all that looks at this, I just, I think it's important because there's so much misinformation and like so much information out there. It's overwhelming.
Well, I think a key element here has been, for lack of a better word, that tribalism, and that it is exciting for people to hear this information from someone of like experience,
Yeah, for sure. We all speak literally the same language anyways. So yeah.
All right. Well, listen, Alexia, I am going to wrap it up smiling and thrilled with what we came up with.
Okay, awesome.
Thank you as always. Episode 33, Alexia Exarchos.
Thank you, Dan.